Hi everyone, today we're here to talk about some of the more uncommon uses of neuromodulators such as BOTOX or XEOMIN. The typical areas that we treat are things like the glabella, so those are the 11s, the crows, and the forehead lines, but there are some other areas also that are really very useful. One of the areas is the nose. So there are some changes that can happen around the nose area. One of them are little bunny lines, so those are those little scrunchy lines, and in some people they can become really quite prominent, or it can be part of their expressions that they make from day to day, and they'd rather have a more relaxed look. A second issue around the nose is sometimes people really have flared nostrils, especially when they smile, and it might not be their most beloved look. And then the third is that sometimes, particularly as we get a little bit older, the tip of the nose can sometimes drop down when we're smiling. So all of those three areas can actually be targeted when we're really careful about how we apply and use these neuromodulators. The second area is around the DAO, as we call it, or depressor anguli oris muscle. So that's a muscle that presents around the corners of our mouth and it pulls down. So in some people, they can have an expression where they're commonly activating that muscle and it tends to pull the corners of their mouth down. And especially, again, as we get older and the tissues, so our skin, the underlying muscles become a little bit softer and more frail, that pull down of the corner of the mouth can actually make us look quite sad or depressed over time. So that's a second really nice use for it. A third area that we can use, which is really one of my favorites, are treating the neck bands. And I can demonstrate for you. These are these bands. It's caused by a muscle called the platysma, which goes all the way down the fronts of our neck. Again, when we're young, it's really not too big a deal because our skin is quite firm and taut and everything stays nice and lifted. But as we get a little bit older, these bands can sometimes look a lot more prominent. They can give us these linear streaks down the front of our neck, and it can also actually pull down along the sides and give us the look of jowls. So again, when we really carefully place these neuromodulators like BOTOX or XEOMIN, it can really help relax it and make the whole area look really quite good. A fourth area, which is really, really nice to treat with neuromodulators, is the chin. So some people get what's called a peau d'orange, which means the skin of an orange. Small little indentations and dimples around the chin. It can be seen when people are smiling and sometimes even when they're talking because they're really activating their mentalis muscle. So with a really quick and easy small little treatment with these neuromodulators, it can relax that whole muscle so that you just look way more relaxed, talking, smiling, and it gets rid of that dimpled look. Another area that we love to treat are the masseters. The masseters are these muscles that are right along the mandible, and they allow us to clench hard. So the benefit of relaxing these muscles, it's amazing for people that are clenchers at night that grind down their teeth while they sleep, and also for people that have overactive masseters and actually prefer to have a slimmer look to their face. So both of those indications, treatment works great. They get a good relaxation about 2 or 3 weeks. We love it. Neuromodulators can be used to treat migraine headaches. It is such a wonderful treatment for people that suffer, that have tried other treatments and have failed. Typically, it's a series of injections. It starts with a history to understand the nature of the migraines and where they begin. It's particularly helpful for people that have a frontal migraine headache. We do the treatment, and patients usually have amazing relief for at least 3 to 4 months. Neuromodulators such as BOTOX is an extremely effective way of treating hyperhidrosis. Hyperhidrosis, it refers to excessive sweating. And if you've ever had excessive sweating, you know exactly what I'm talking about. It's soaking through your clothing so that you get sweat stains, really high dry cleaning bills because you wear an outfit once and it's got to be cleaned right away. It's actually a really huge issue that can be embarrassing for a lot of people. Ever since we've had BOTOX to treat this, it's really provided amazing relief to so many patients. So we can inject it. Some of the most common areas are in the underarm. There are other areas like in the groin that can be treated. Sometimes if people have a lot of excessive facial sweating, it can be used there as well. It's really very effective. If you've ever had this concern and you want our help, we would love to take care of you.